Hello, welcome to Health Talk with Dr. Toyin. Today we'll be discussing cervical cancer, and I'll discuss this under the headings of the definition, the risk factors. I'll talk about human papilloma virus, and then risk factors with those infected with human papilloma virus, the clinical features, and treatment with prevention. Before I continue, if you've not subscribed to my channel, please pause this video and hit the subscribe button that is found at the bottom of this video. And it will alert you when there are new videos so you can watch. As I said earlier, I'll be discussing cervical cancer today. The cervix is what is called the neck of the womb. And when there are abnormal cells detected there, that is when we refer to it as cervical cancer. In 2018, cervical cancer was the fourth commonest cancer in the whole world. There is a global program to try and make cervical cancer not to be a global threat by 2030. The risk factors of the development of cervical cancer include age at onset of intercourse. So the earlier the age, the more the individual is at risk of developing cervical cancer. Secondly would be the number of sexual partners the person has. The more the sexual partners, the more the risk of developing cervical cancer. Also, the risk status of the partner of the individual. If the partner has a number of previous sexual partners, the individual is also at risk of developing cervical cancer. And also with those that do not use condoms, they are at risk of developing cervical cancer. You cannot talk about cervical cancer without talking about human papilloma virus. Now, human papilloma viruses are a group of about 100 viruses, and out of that 100, about 15 cause cancer. Out of the 15, types 16 and 18 cause about 3/4 of the cases of cervical cancers, and these are known as the high-risk viruses in human papilloma virus. Human papilloma virus is mainly transmitted through sexual intercourse, and people become infected shortly after the onset of sexual intercourse. Human papilloma virus has been implicated in cancers of the mouth, the throat, the penis, the vagina, the vulva, cervix, of course, and the anus. For those that have been infected with human papilloma virus, some other things make them more prone to developing cervical cancer, and this includes co-infection with other sexually transmitted infections like herpes simplex virus or human immunodeficiency virus. Also, for women that smoke, they are at increased risk of developing cervical cancer. If the woman has a first-degree relative who has cervical cancer, they are at increased risk of developing cervical cancer. And for those that are on the oral contraceptive pill for more than 5 years, they are at increased risk of developing cervical cancer if they're infected with human papilloma virus. The clinical features of cervical cancer include 1. The woman might not have any symptoms. Secondly, there might be pain in the pelvis or pain on intercourse. Number 3, there might be an offensive vaginal discharge or vaginal discharge as like mucus. 4th, there might be a blood-stained vaginal discharge. Number 5, there might be bleeding after intercourse. 6, there might be bleeding in between periods. And 7, for a woman who is menopausal, there might be some vaginal bleeding. The ways to prevent this: in some countries they have vaccination programs for girls between the ages of 9 to 14. And in some countries they also include boys, because as I explained earlier, even the partner's risk in terms of previous sexual partners will also affect the female. In the United Kingdom, this program involves girls between the ages of 12 to 14. There is also what is called a cervical smear, or in some places a Pap Smear, which basically involves taking samples from the neck of the womb and analyzing under the microscope. It involves inserting what is called a speculum into the vagina to open up the area so the neck of the womb is visible. Depending on the type of smear done, it's either a feather-like substance or a small wooden substance that is inserted to collect samples. It can produce a bit of discomfort but not pain. In England, the cervical screening program is done every 3 years between ages 25 to 49 and every 5 years between 50 and 64 years, and it might vary country to country. In all cases, it is advisable, if from the age you've been sexually active, to have a smear done at least every 3 years. For those that have just given birth, you need to wait 12 weeks before you can have a cervical smear done. Other ways to prevent cervical cancer include the use of condom and also limiting the number of sexual partners. For those that have cervical cancer, ways of treating include things like surgery, chemotherapy, and radiotherapy. I hope you enjoyed this video. Don't forget to subscribe to my channel, watch and share this video. And until next time, smile because it's healthy. Bye.